Swayam Prabha. Digital India. Educated India.
Welcome back. In lecture 48, we will cover urban health services, and this is part 1 of the lecture. The different concepts that we will cover in this particular lecture are health service provision in urban areas, thrust areas for the national health policy, national health programs, and interventions in urban areas considering NUHM. So, as we know, as we have already learnt about the provision of health centers in urban areas, and we have also learned briefly about the different National Urban Health Mission, as well as the National Health Mission and the National Urban and Rural Health Missions. So, Ministry of Health and Family Welfare, Government of India has launched this National Urban Health Mission in the year 2013. And the reason it was launched, it was made separate from the rural mission, was because there has been a lot of, there are specific problems in the urban areas in regards to health, and particularly the most affected are the urban poor who lives in listed as well as unlisted slums. And in addition to that, there are a lot of vulnerable population in the urban areas, such as the homeless people, rag pickers, street children, rickshaw pullers, construction and brick line clean workers, sex workers and other temporary migrants who doesn't really have a place, a permanent place to live, and that's why some of them live in unlisted slums, or even they squat in certain areas of the city where they find some place where they can put down some of their meager belongings and all. So, how do you provide healthcare services for these people? Because they neither have a fixed area, or sometimes they also change their area and so on. So, this is why the National Urban Health Mission has been developed in specifically to cater to this population groups or these vulnerable population groups. So, in addition to that, the other aspects that are covered are, of course, on public health in general, which is includes sanitation, provision of clean water supply, and control of vector-borne diseases. So, we will not cover vector-borne diseases in details here. We will cover that in some other module. But in general, these are the different areas. In addition to provision of direct healthcare services, these also are taken up together so that the overall well-being of the residents can be achieved. So, in addition to that, strengthening the capacity of all public healthcare providers, including health personnel of the ULBs, because until unless we have very trained health manpower, we cannot provide proper services. So, these are the areas where this is the reasons why the urban from rural health mission to we have now provided general health mission, and then within that we have now have National Urban Health Mission for urban areas as well. So, right now the health mission covers around 994 cities with population greater than 50,000, and in addition to that, all district and state headquarters are being covered under this particular urban health mission. Now, there are some cities which are less than 50,000 people, which are very small cities and all. In that case, it's difficult for the urban local body to have all the infrastructure and facilities to provide this kind of services. In that case, all the provision work is being done via the state government's health department in conjunction with the ULB, of course. But it is done as per the standards and all as per the norms of the National Rural Health Mission. So, smaller urban areas falls directly under the National Rural Health Mission, whereas larger urban areas fall under the National Urban Health Mission. So, some of the thrust areas that the National Health Policy, which was launched in the year 2017, talks about. The first one is that we have to increase investment in health. So, that means that right now the target is around 2.5% of the GDP of the country. So, which is the target? Of course, we are not there yet, but we are trying to achieve that target. Now, directly the central government allocates resources to the state, and that allocation is done based on multiple factors. First of all, it considers multiple development indicators on how the state is growing, how it is improving the healthcare services and so on. Absorptive capacity, that I can put in money, but it will not, it would be impossible to spend that money. So it depends on the absorptive capacity as well as other financial indicators like utilization and all these things, which determines how much money should be allocated to the states. So directly the money comes from the central government, and the state governments, after it gets its share, it will allocate the resources to the different ULBs as per population, as per the size of the ULB and so on. As per size as well as incidence of certain diseases or certain other certain factors which will determine how much money should go to particular ULB. Now, the money that is collected, or where do we generate this money that is spent for healthcare? So usually it comes from the general tax of the country as well as some specific taxes targeting tobacco, alcohol, food impacting health, then taxes on extractive industries, pollution cess, and corporate social responsibility funds. So these are the areas from where we can collect some extra money and which we can utilize for providing adequate healthcare in different parts of the country. Now, one of the focus of the national healthcare policy, as we have already discussed earlier, that we are trying to provide free healthcare, diagnostic services, then some amount of medicines. These are provided free of cost. Along with that, we are looking at a comprehensive healthcare policy, right? That means we are providing comprehensive healthcare services covering, community-based services and until the tertiary services like, very, very specialized medical healthcare and so on. In between, there is primary care, secondary care, and so on. Now, but the basic change from earlier is to go for preventive and promotive healthcare. That means you are not only doing curative healthcare. That means in case of an ailment, you go to the health center, you are treated for it. So that's the curative part. But when we are talking about preventive and promotive, that means you are taking measures to prevent certain healthcare problems or prevent an outbreak of a particular epidemic. Or promotive health means you are doing some campaigns, you are doing some certain educational programs, you are doing some training programs like you are conducting yoga trainings and all these things, so that you promote better health in the society. So this calls for coordinated actions in 7 priority areas, and overall our target is to achieve Swasth Nagarik Abhiyan, and the program is known as Swasth Nagarik Abhiyan. So that means we are trying to create healthy individuals or healthy citizens, you can say. So these 7 priority areas are, of course, the coordination has to be with the Swachh Bharat Abhiyan, because health cannot be achieved just by providing good healthcare services, but also by overall cleanliness or overall sanitation and proper water supply to that area. So that's why Swachh Bharat Abhiyan is directly linked with this kind of services. Then balanced healthy diets and regular exercise, promotion of this kind of things. Then addressing tobacco, alcohol, and substance abuse from other side. That means prevent all the negative, things which deteriorate health. Then Jatri Suraksha. So this is to improve the safety in rail and roads, right? And then Nirbhaya Nari, action against gender violence to protect our the female gender. Then reduce stress and improve safety in the workplace, and then reducing indoor and outdoor air pollution. So these are the different areas of intervention, you can say, or you can say that these are the, along with health improvement, these are the areas which also needs to be improved so that the overall health and wellness of the society improves. Now, within that, once we are talking about this preventive and promotive healthcare approach, we also have preventive and promotive care along with curative care. That is what has to be provided. So what kind of care we are talking about? So early childhood development delays and disabilities has to be looked into, adolescent and sexual health education, behavior change with respect to tobacco and alcohol use, and screening counseling for prevention of common chronic illnesses such as non-communicable diseases such as hypertension, diabetes in urban areas. So you see, in Indian urban areas, there is a lot of incidence of hypertension, diabetes. These are lifestyle diseases, you can say. So along with that, so understand which people are vulnerable for this, to do screening based on certain kinds of direct diagnostic or through certain tests and all. And then counseling people that, okay, this is how you can avoid this kind of diseases and so on. So this is one big part of, how you approach healthcare. Then how do you change behavior of people so that they don't, gradually reduce use of tobacco, alcohol, and so on, and all the other aspects as well. So that is how you achieve preventive and promotive healthcare along with curative care as well. Now, in addition to that, uh, overall, the health policy focuses on coverage extension of services. That means all communities, all groups are covered, and overall improvement of services. Different age groups has to be looked into separately because each has got different kinds of needs. Then the school itself should be a site of primary healthcare. That means the school itself should be an area from where healthcare provision starts, and promotion of safe health and hygiene practices, and of course provision of health, providing health education in the schools itself. Then the Ayush system, as you know, Ayurveda, then your Unnani, Siddha, homeopathy, yoga, all these things should be made part of the healthy, to promote healthy living, and certain other lifestyle diseases and all could be prevented using this kind of measures. So the Ayush system has to be linked with the standard medical or the primary healthcare as well. Then practicing yoga in workplace, schools, and community. Workplace hazards and occupational health and accident prevention, we talked about that. Strengthening of village health, sanitation, and nutrition committee, and their equivalent in urban local bodies. So basically, we are focusing on health, sanitation, and nutrition, and there are committees formed on that so that those could be improved together in the both rural as well as urban areas. Then health impact assessment. Any kind of projects that would be undertaken, what would be its impact on the health? Earlier, we used to do only impact on environment and all, but we also have to see how it will impact health as well. And finally, we are talking ASHA, that is accredited social health activities. So creating a manpower, which a dedicated manpower to actually deal with the communities, or to engage with the communities so that we can provide healthcare directly to a person's home. So that is why this ASHA activities has been formed, and they are the ones who are taking healthcare to the people directly. So when we talk about the different levels of care, the care should start from primary care, of course, and this care also needs to be continued as well. So that means the care should not stop at the primary level, it should be continued to other higher levels as well. So comprehensive primary health care includes both, along with curative care, geriatric health care, palliative care, rehabilitative care. So we have talked about promotive, preventive, curative, this kind of care. Along with that, we should look into the care for older people, all the different problems that arises with health with old age. So that's why it's known as geriatric health care. Then palliative care, usually palliative and regenerative rehabilitative care is for the old people themselves. For example, in certain kinds of diseases like cancer and all, it usually affects the older population. So in those cases, how to provide continuous care for this kind of people who are suffering from this kind of diseases. So that is palliative care, and rehabilitative care is also for, like, somebody has certain problems are happening, like you have some fall has happened with an older person, how to bring him back to again to 100% capacity. All these things are part of the rehabilitative care. And if somebody has faced certain kind of trauma and all these things, all those people, how to treat with those. So earlier these were not the focus, only curative part was our focus, but all this has now come into focus as well. Now, that's why primary healthcare centers are now known as health and wellness centers. So both primary healthcare centers, community healthcare centers, as well as the services are known as health and wellness centers. So we are trying to achieve overall health and wellness for the people. So within this, we are having a family health card has been introduced, and this links the individual with a primary healthcare facility to which he belongs, and also it defines the eligibility for certain kind of service packages, in the entire country. That means he can also avail services in other states or other places where he can use this card to go and avail these services. Then the referral system, that means we should not stop. Suppose